How do we dose RHESUS immunoglobulin? Why and how do we administer RHESUS immunoglobulin? RHESUS immunoglobulin is a medication used to manage and treat rhesus negative pregnancy and prevent hemolytic disease of the fetus and newborn. Hemolytic disease of the fetus and the newborn is the destruction of red blood cell of a fetus and neonates by antibodies produced by the mother. HDFN occurs when the mother has been immunized to the father's antigen through fetal-maternal hemorrhage. In the case of HDFN, the antibodies are directed against antigen on the fetal RBC that were inherited from the father. What is the action of rhesus immunoglobulin? The mechanism of action of rhesus immunoglobulin is the interference of B lymphocyte priming to make anti-D. The first dose is provided at 28 weeks of gestation because most women who develop anti-D during pregnancy, they do so at or after 28th week. A second dose is given after delivery, typically within 3 days or 72 hours. Even if the infant is stillborn, rhesus immunoglobulin is still administered. In addition also, rhesus immunoglobulin is also administered after amniocentesis, chordocentesis, virgin, abortion, or abdominal trauma. What is the dosage of rhesus immunoglobulin? The regular dose vial of rhesus immunoglobulin in the USA, or 300 microgram vial in the UK, contains sufficient anti-D to protect against 15 milliliter of packed RBC or 30 milliliter of whole blood fetal-maternal hemorrhage. In cases of massive fetal-maternal hemorrhage, especially more than 30 milliliter of whole blood, a maternal sample should be obtained within 1 hour, and the quantitation technique, especially Krichauer-Bethke test, must be performed. What is Krichauer-Bethke test? A maternal blood smear is treated with acid and then stains with a counterstain. So fetal cell contain hemoglobin F, which is then resistant to acid and will remain pink, whereas maternal cell will not resist to acid and they will appear as ghost cell because of loss of hemoglobin. This is a typical smear in Krichauer-Bethke test, and you can see the pink cell here represent fetal cell and ghost cell or faint stained cells represent mother cells. What you do under microscope, count at least 2,000 cells, and after counting 2,000 cells, considering that every field contains at least 200 cells, then count the cells that are staining pink. Those cells represent a portion of fetal cells in the mother's circulation. The volume of fetal cell is also calculated as well. Fetal-maternal hemorrhage, it is calculated as fetal cell over total cell counted, which is of course 2,000, times maternal blood volume. How will you know maternal blood volume? If it is not given in your question, consider maternal blood volume as 5,000 milliliter of whole blood. Whereas, of course, fetal cell should always appear as pink cell, and total cell counted in general, it should be at least 2,000 cells. Example then, you can use the formula to calculate fetal-maternal hemorrhage by taking fetal cells, which is 6 as our example. We counted 6 cells over 2,000 cells times 5,000, of course, which is maternal blood volume. And this will give us 15 milliliter of fetal whole blood in maternal blood circulation. Or we can use the second formula where you take percentage of fetal cell times 50. That will also give you fetal maternal hemorrhage in milliliter. So here we can take our example as 6 cells counted times 100 over 2,000, which is of course a percentage, times 50. So the 50 is a number that's given, and this will give you, of course, exact number or exact volume of fetal maternal hemorrhage in milliliter. So as we mentioned previously, because one dose or vial of rhesus immunoglobulin covers 30 milliliter of whole blood, then the calculated volume of a maternal hemorrhage is then divided by 30 to determine the number required vials of rhesus immunoglobulin. For example, our fetal-maternal hemorrhage was 15 milliliter of fetal whole blood, then 15 milliliter over 30, it will give us 0.5 vials. So then it means our fetal-maternal hemorrhage will be covered by 0.5 vials. But because of the wide estimate generated by the test, if the calculated dose to the right of the decimal point is greater than or equal to 0.5 vial, it should be rounded up to the next whole number plus 1 vial. This is the rule. So then if the calculated dose to the right of the decimal point is less than 0.5 of the vial, then it should be rounded down to the next whole number plus 1 vial. So then for the above example, the dose to be given then for our example is 0.5, which is then rounded up to give 1 vial plus 1 vial, which is of course there in calculation, that will give us 2 vials. So then therefore, according to our example, the dose to be given to our mother is 2 vial. So thank you so much. If you have any question, please write it in the comment box. Then we shall be back to you soon.